Hi everybody, I'm Ari. Welcome to our RHA virtual event. I'm one of the aesthetic nurses here at Changes Plastic Surgery. We're very excited that you were able to join us. If you're able to, I would encourage you to stick around after we complete the event for a live questions and answers segment. You can submit any questions you might have through the questions tab. And myself or Katie Page, our other wonderful aesthetics nurse, will be able to clarify anything you have questions about. We also are going to be offering some specials for today only on the RHA collection. Those specials are going to be, if you buy 2 syringes for the cheeks, you are able to get 50% off a syringe for lips. And then the other kind of special we're doing is going to be $50 off any RHA syringe. Once again, those prices and these specials are only valid today, so please don't hesitate to give us a call and book a consultation or a treatment if you're an existing patient, and we'll look forward to seeing you soon. The RHA Collection is a hyaluronic acid based filler. Hyaluronic acid is an element that is native to our own skin. It's present in our own tissue. This filler was created in Switzerland in 2008 by one of the co-creators of Juvederm. There are 3 different fillers in this line. RHA2 is a wonderful filler for lip augmentation. It gives a very natural and beautiful result. Also, it can be used for the perioral lines or smoker's lines, those little etched in lines that we develop as we get older. Another area where we use it, or we see static lines develop, those are those little etched in lines, is around the mouth. Also up by the crow's feet area, sometimes you can see those lines start to extend down as we lose volume and elasticity in our skin. RHA3 is the next step up as far as filling deeper lines or areas of volume loss. If you are searching for a more projected lip or full lip, this is a great filler for that. Another area that I personally like using it is in the nasolabial fold area, or these smile lines. Also down in the marionette area, when we get volume loss, or we start to see some of that kind of hollowing out here. And then the RHA4 is really beautiful in the jaw to create more definition. chin as well for projection and definition, and then also for any kind of hollowness or flattening in the cheek area. It helps to create that lost volume and lift. Another area I personally love using the for is in the temple. As we get older, this area hollows out, and the RHA 4 really gives a nice subtle pop of enhancement there too. So there's quite a range in this collection for different concerns, and each one yields beautiful results. RHA is different from a lot of the other hyaluronic acid based fillers on the market, primarily because of how it's processed. When they go through the manufacturing process for RHA, it is a gentler process which maintains the structure of the hyaluronic acid, therefore making it far closer to our natural native hyaluronic acid in our tissue. So it creates a very beautiful natural look, not stiff. It also is the only FDA approved filler to treat dynamic lines. Dynamic meaning any kind of facial expression, smiling, nasolabial fold area, so these smile lines here, marionette lips. So it never looks stiff. You know, sometimes other fillers can appear stiff, or you can see them in the tissue. RHA is a very natural looking filler that is strong enough and has enough dynamic that it is able to look very natural when a person is animating or smiling. This filler also does have a longer duration than a lot of other fillers on the market, which makes it unique in that sense as well. So there are many different things that sets this line apart, a few that I've mentioned, but it does all culminate into a really beautiful result for the patient. We chose to bring the RHA collection into our practice for a number of reasons. Obviously, the manufacturing process being a little more gentle, it has been shown that people tend to be less reactive to the RHA collection because of the way that it's created. So patients who have had issues with fillers before or are worried if they have autoimmune issues, this is a great option for them. The other reason is because we are a practice that really believes in staying current with all of the best products and treatments on the market, and RHA is really a unique filler because of how it's manufactured and how it works in the face and how resilient it is with facial movement and natural it looks. Also, it is a great price point for patients and yields a beautiful result. A good candidate for the RHA products is really anyone who is looking to help minimize or soften the static lines or those etched in lines, but also even more so anybody who is concerned with dynamic wrinkles. So those smile lines and down in this area, especially around the mouth. And the cheeks, because when you animate, this filler just moves so beautifully with your tissue. It's so natural, so soft. And also anybody who in the past has used fillers, maybe a different brand, and has had a reactive type of experience, or even autoimmune problem where you've tried other fillers and it hasn't been great, or you felt that other fillers were too stiff or didn't move naturally for you. This is an amazing line of filler that is really great for almost anybody who's looking to just kind of enhance their natural beauty and soften any types of signs of aging that have appeared, or volume loss. It's just really a really versatile line that's great for a wide range of patients. So patients always want to know, when am I going to see my maximum result? Or when will I see my final results? So you're going to see an immediate result, immediately post-procedure. There will be a bit of swelling that will increase as the day goes on, but I do tell patients that you will see the immediate result. It is going to be the best representation of what the final result will be, minus some swelling. But for a maximum result, I do tell patients about 2 weeks. Reason being is anytime you have an aesthetic procedure, any type of medical procedure, there's typically going to be some swelling, some inflammation. Anytime we do an injection, there's always a potential for bruising. So it does take some time for bruising and swelling to resolve. Initially, the bruising and swelling, if you do develop bruising, not everybody does, is going to be the worst in the first couple days, and then will start to dissipate after that. It also takes time for the product to integrate into your tissue and begin to kind of move with your tissue as effortlessly as this product does. So I advise patients to give it about 2 weeks for everything to heal and to settle before making a judgment or deciding if they want more or it's too much. So it is an exercise in patience, but it's well worth it. And at the 2-week mark, I do usually say if we feel like we need to tweak anything, or if the patient would like more product, that's an appropriate time to do so. So what can you do prior to treatment and after treatment to make sure that you have the least amount of social downtime or downtime possible? I tell my patients to avoid anything that is going to make your blood thinner. Those types of things include fish oil, aspirin, ibuprofen, Motrin, Advil, Aleve, alcohol. And I tell them to do it for a minimum of 3 days. If you can stay away from those products for at least a week, that's ideal. Sometimes you cannot do that. Some people are on, blood thinners for medical purposes, and that's understandable. I just let them know you will be more likely to have a little bruising. The other thing is, I do tell patients you can take Arnica in advance. Arnica is an herbal supplement that helps reduce bruising and swelling. This can also be taken post-procedure as well. It can be applied topically. It can also be taken orally, so that it's more systemic, or you can do both. Those are the things that I advise for patients as well. Post-procedure, I do advise that patients avoid any kind of facials, having dental work for 2 weeks, because you're manipulating the face, especially if you're having your lips done. That filler hasn't fully set yet, so we just want to minimize any kind of mobility of it. So you'll want to avoid, the dentist. You'll want to avoid getting a facial. You may want to avoid getting a massage where you're laying face down on a table. The other thing for post-care is you probably don't want to work out for a day or two. What that will do is just increase your swelling and bruising. Also, you'll want to stay away from those medications or supplements that do make you bleed a little more, because if you do develop any bruising, it will make that bruising worse. And so continue the Arnica. Also, icing in the first 24 to 48 hours, about 20 minutes on, 20 minutes off. Not only does it help assist with any discomfort, but it can help with the swelling. So those are the things that I usually recommend for patients in the immediate post-procedure. And it typically works out really well. Downtime is very, very short for most patients, but I do like to prepare you. Everybody swells differently and all of that. So those are the general instructions I would recommend. So results for filler. Everybody metabolizes filler differently or chews up filler differently. A unique thing about RHA is that it has been proven to last at up to 15 months, which is wonderful. So about a year and a half, which especially from a financial and also just from a procedural downtime perspective is a huge advantage. So these products are great because they are long lasting, they're natural looking, they move beautifully in the tissue, and just yield a very natural result with very, very little side effects and things like that, aside from just post-injection. So typically up to 15 months, but everybody once again metabolizes at a different rate, so it's possible in order to maintain your full correction or result, you may need to come in for a touch-up before 15 months to add just a little more to maintain that result. But it does last quite a while. So Shanae is the beautiful patient here who has some concerns regarding her perioral area, so her nasolabial fold. And I also discussed with her possibly treating a little bit in her mid-face to help lift. For this treatment, we are going to use RHA 4 because it has the type of structure that we need for the mid-face. It is going to be nice and stretchy, but it's also going to kind of withhold its form and function with facial movement. And then I'm going to use the 2, which is a little thinner throughout her nasolabial fold area. She doesn't need much, just a little width, but it will help to improve and smooth and soften those lines for her. So we're going to start with the cheek, just to help restore some mid-face volume loss that we all get as we age. So here we go. Okay, 1, 2, 3. And this product is great because it is FDA approved for 15 months. And you can already see how nicely that is, so subtle, but it lifted her just enough.
All right, so a little poke out here. 1, 2, 3. How you doing with that? Not bad, right?
No, not at all.
So we're just giving a little structure to the cheek here, building up out here. Oh, this looks good. So this is RHA 4 that we're building a little structure. We are using the 4 because it's one of the thicker fillers. It's also FDA approved for a year and a half, and it's one of our premier products. So just restoring that natural volume to the place that you lose it from. Picks up on the lower face, makes you look a little more rested, gives a little more contour to the face.
We are going to add a little bit of projection to Jasmine's chin. I'm going to use RHA 4 because it provides structure, and it also is strong enough to maintain its shape with the constant movement of the face, which is why it's a great filler choice for this area. So you can see I haven't even finished the syringe, but there's quite a nice amount of projection and shape to the chin now, which also helps to really define some of the jawline.
So we're just building a little structure to the lip initially. Jazz has gorgeous lips, but we just want to get it to flip up a little bit so it can handle the volume. This is the spiciest part of the injections on the lips, and you're doing great. Okay, a little massage.
Thank you so much for attending our event. Once again, we're so happy you could join us. Hopefully you're as excited about the RHA collection as we are. And please go ahead and check your texts and reply yes if you would like to schedule a consultation or an appointment, and we will contact you to do so. And once again, if you do have the availability to stick around for another 15-20 minutes, Katie and I will be answering some live questions. So feel free to submit those, and we'll look forward to chatting with you.
Oh, there we go. Okay, hello. My name is Cassie. I'm the office manager here at Changes Plastic Surgery. You guys already heard from Ari, one of our wonderful aesthetic nurses, and Katie. She's also one of our amazing aesthetic nurses. I've had them inject me with many things already. I'll give you a little preview. Hi. But then we need to be compliant. Okay, so our first question says, if I have other filler that is wearing off, can I add RHA to these areas? Does it hurt to combine RHA with other fillers? Katie, sure.
No, you can add RHA to any products that you've already had injected. There's no problem with doing that. And it blends nicely with other, and especially since it's so natural and so close to your own collagen, it'll just look great on top of it.
So Maggie wants to know if we're having specials on RHA, and we are going to be having specials on RHA. If you call and book your appointment with us, we will be giving out special deals today for RHA. And then
is that going to be in the text too?
It is going to be in the text. So if you reply yes, they will send you out what that is. Pam says, why is it better than Juvederm or other fillers? Well, Juvederm is an excellent product, but the person who invented Juvederm said, I can make it better. And she did. She went to Switzerland, and 12 years ago, they invented RHA filler, and they've had great success over there for the last 12 years. And then they brought it to the US approximately 18 months ago. And we've had a wonderful experience using it in our office since then. Colleen. It looks like a direct injection that finds its way as opposed to you directing. Hold on. Sorry, guys. That is opposed to you directing the injection. Is that right? How do you inject RHA?
Go ahead. So we inject it. It's going to be very similar experience to other fillers that you've had. As the injectors, we determine how to inject each product, but as far as the patient experience, it's going to feel pretty similar across the board, regardless of what product is being used on you. So it's kind of just the injector's technique. It's not so much a different experience for the patient, but it does give a nice result. Different products we inject a little bit differently to achieve the best possible outcome. Hopefully that makes sense.
I'll add on to that. The RHA can be injected with a cannula or with a needle direct injection. So yes, you can do it either way.
Okay, it says, does it work under the eye for tear shed area to not look so tired?
I can speak to that. So I believe RHA is coming out with RHA 1, which in a recent training, educational training that I attended, they said is going to be a wonderful product for that area. I would recommend you coming in and seeing Katie or I for a consultation if if you have specific concerns, and then we can make a recommendation as to what product would suit your needs best.
And to make sure that that's the right treatment.
Exactly.
We definitely never want to give you a treatment that wouldn't be indicated for an area just because you wanted to have something done. So we are going to come in. We're going to bring you in. We're going to do a full assessment. We'll do photos of you, and then we'll go over your goals, whatever your skin health and your goals are for how you want to look, and then we will make a plan for how you want to look and how to get there. And then let's see here. How many days prior to the procedure and then post do we want to avoid Motrin and alcohol?
So I'll answer that. Like Ari had said before, we usually recommend at least a couple of days if you can. If you can make it up to a week, that would make it even better. And just because you have the aspirin or the ibuprofen or the alcohol doesn't mean that you're necessarily going to bruise. It just means that you're more at risk to bruise.
All right. And then the next one down also was about bruising. So yes, it can cause bruising. We've addressed that a couple of times. If you do get bruising, we do have Arnica in the office that we're happy to have you pick up a bottle while you're here to take to help minimize any bruising and help your body process that bruising out. We also have post-injection cream that you can apply to the area to help your body process that bruising out, so that instead of being bruised for 3 to 5 days, hopefully we cut you down to 1 to 3 days. That's our goal, is to just minimize any bruising, but then you still get the benefit of the treatment. And then we already talked about we can mix RHA with other fillers.
Yeah, they even have said that you can layer it on even on top of other fillers, and it works beautifully in that sense as well.
Perfect. And then I have sagging jawline and my lips are turned down, kind of like the corners, like a sad face. And they want to know if we could use RHA to help fix the jawline and the lip fillers.
Go ahead.
There are a lot of different things that we can do to with filler to help correct concerns. I would say in order to really create the best treatment plan for you, we do need to see you in person so that we can do a proper assessment and make sure that we're recommending everything that you need. It's really difficult. Our job is so visual that we would really recommend that you call. We would love to see you in office for a complimentary consultation.
And then if I book a consultation can I get my filler the same day? And yeah,
definitely. We usually book our consultations for about an hour, so we have time to do an injection as well, depending on what you're needing, depending on how long the consultation takes. But usually we can fit both into the same treatment time.
Yeah.
Perfect.
I would just maybe when you call us, just let us know that is kind of what you're hoping to do, just so that we make sure that we can make your appointment long enough to accommodate that treatment as well as enough consultation time.
Awesome. And then I have had some questions about cost. So we don't change, the price doesn't change for which type of filler, RHA 2, 3, or 4 you get. It's $700 a syringe. And then it's really up to the nurses and you to dictate how many syringes you're going to need per area. So that is actually one of our best price fillers in the office.
For the longevity,
for the longevity, it's an amazing price that RHA is able to help us give you. All right, so I loved watching you guys. Thank you for putting this together. I appreciate it, and I love meeting all of you guys. We are having some amazing deals on RHA. Go ahead and text into your. Go ahead and reply to the text so we can get you booked in here, because we're giving like 50% off a syringe, depending on what you want. So you should give us a call. We'll get you in. All right, you guys. You guys have a great day.
Thanks for joining us.